It's no surprise that poverty causes mental strain, leading to mental illness. The constant worrying about not being able to pay bills wreaks havoc on the psyche. Parents who constantly worry about whether or not they're going to be able to feed and house their children are some of it, if not the largest worries that they have. Stress is also abound in poorer communities over concerns of safety. Having to worry about violence also takes a significant toll. But what if you don't live in a lower income neighborhood? What if you had the same job with the same income, but lived in a higher income neighborhood? Would you be better off mentally? As it turns out, no, you wouldn't. Instead, researchers found that death rates were highest among people of low socioeconomic status who lived in affluent neighborhoods. That finding surprised the researchers, but every way we looked at the data, we found the same results, said co-author Catherine Cubbin, PhD. The researchers said that findings also indicate that this particular group of people might be medically underserved and need more targeted services and attention by health policymakers. This was discovered by looking at the data from another study. It analyzed heart disease risk factors in California between 1979 and 1990. The study followed 8,200 men and women from 82 neighborhoods in Monterrey Modesto Salinas and San Luis Obispo over 17 years. First, they used income and education information to work out a person's socioeconomic status. Then they were divided into low, moderate, or high income groups. They did the same with neighborhoods. The study showed that as this time went on, the difference in death rates increased. 19 out of every 1,000 women of low socioeconomic status who lived in wealthier neighborhoods had died, compared with 11 out of every 1,000 from poorer neighborhoods. Making sure the study was legitimate, they accounted for obesity, hypertension, and smoking, which did not affect the results. Access to neighborhood goods and services also did not affect the outcome. The current theory is that poor people in high-income neighborhoods have worse health for psychological and social reasons. Essentially, knowing you're the bottom rung of society has an effect on your mental health. No surprise. Knowing that you are marginalized and experiencing that worsens your physical and mental health. Also not surprising. The researchers conclude that there's a population whose needs are overlooked and underserved by government agencies and health workers, and that the very nature of a class divide, even ignoring any other externalities, by itself literally does cause people to have worse physical and mental health just by its existence, not even with any actual physical mechanism. Just the existence of class itself harms people. Thank you for watching. If you like this program, then please head over to my Patreon page and set up a monthly donation. It's your donations that keep this program running. Also, if you would like, please rate, comment, subscribe, and share in various social media.